Hello, my name is Christopher Duran and I want to speak to you today about kneecap problems that can lead to dog arthritis. The knee joint of dogs is very similar to our own, identical to our own in fact, and in small breeds of dogs this kneecap has a tendency to slip or click towards the middle or the inside of the knee, and it will do this many times a day in some dogs, causing immobility of the joint, severe pain, damage to the cruciate ligament, and I guess all the signs of dog arthritis and the reduced mobility and quality of life that goes with it. So firstly we want to understand the kneecap in dogs. It's covered in cartilage and it runs down a little groove that's been created for it on the bottom of the femur, just like us. But when this kneecap shifts towards the middle, it will ride up along the side of this trochlear groove or over to the other side of the trochlear groove, and will eventually lead to thinning of the cartilage and exposure of the bone underneath the cartilage, and at that stage you're going to get some pretty serious arthritis. Small breeds are affected, so poodles, Yorkies, Pomeranians, Chihuahuas, Pekingese, there's plenty of small dogs that get this. The technical name for this condition is medial patellar luxation, or MPL. And it's interesting to talk about how it comes about in dogs, and it's actually a hip problem more than a knee problem. There's a change in the angle of the hip that small dogs are born with. This angle change will reflect all the way down through the other joints of the hind legs, and the knee joint is the most susceptible to these changes, and in this joint you will see a number of problems. Firstly, a weakness or a stretching of the joint capsule around the knee, a shallow trochlear groove, which is the groove that the kneecap should run up and down in. If this groove is shallow, then the kneecap has no reason to stay there. And the third thing that they can get is a repositioning of the kneecap's lower attachment, called the patellar tendon, and it will shift towards the middle or the inside of the knee, and this will in turn really drive the luxation or the clicking out of place of this knee. So the signs of medial patellar luxation are initially quite mild. Dogs don't seem to mind having their knee clicked in and out of place many times a day, which is a bit odd if you ask me, but it doesn't seem to bother them. And this is obviously good for the dog in the early stages, but it also lulls the owners into a false sense of security because they are reluctant to do invasive surgery on a dog that's walking around just fine. It's only at about 3 or 4 years of age that they start to show a lameness on the leg, and this is when the arthritis has started to set into the joint. The problem here is that once arthritis is set in, I can't do much about it surgically, so they're always going to have a problem with their knee at this stage. So early surgical treatment is the best option for most of these dogs if they have a high grade medial patellar luxation. We as vets grade them on a scale of 1 to 4, 4 being pretty bad. And the surgical procedures vary depending on the grade, but in general we look to deepen the groove, we look to tighten the joint capsule, and to move the patellar tendon, which is where the patella sinks onto the tibia. We look to move that to a more central position so that it's not shifting inwards. And this is a highly successful surgery if it's done properly. It's one of my favourite surgeries in fact, and I do quite a few of them. And the trick, as I mentioned before, is to do it early. If you leave it until it's arthritis, it'll still help, surgery will still help, but your dog is still going to have some arthritis, and that arthritis may progress. If you get it early, maybe 12 months, maybe 24 months of age, then these dogs can do very well indeed. The low-grade patellar luxations don't necessarily require surgery, but they are probably going to get some arthritis in their later years. And that arthritis can be managed through all the things that we talk about on this vlog. What to do next? I would have a chat to your vet if you're at all concerned about this condition, and go through the pros and cons of early surgery rather than sitting on it for too long. If your dog already has this problem, surgery may still be helpful, but you will also need to look at some arthritis treatment as well. You can have a look at my blog. You can also download my free ebook, which touches on this topic a little bit and gives a nice broad overview of dog arthritis treatment. Thank you. My name's Christopher Duran.